Good afternoon. Clinical features and management of late IOL decentration in the dead back syndrome. No financial disclosure. This was a term coined by Dr. Samuel Masket, which characterized by spontaneous rupture of the posterior capsule years after an uneventful IOL cataract surgery. IOL decentration within or outside the bag remains in situ with total or partial anchorage, and it is always a clear capsular bag without fibrotic changes. Many authors have described the clinical and histopathological findings in the dead back syndrome. This is a distinct clinical entity which is to be differentiated from zonulopathy, where the whole bag with the IOL decenters due to weak zonules. In the dead bag syndrome, the bag remains in situ and there is a spontaneous posterior capsule rupture. Only the IOL decenters or dislocates. The aim of this study was to study the clinical features and management of eyes with dead back syndrome. This was a prospective interventional case series of eyes that presented with late decentration of IOL with a ruptured or absent posterior capsule after an uneventful cataract surgery from June 21 to October 24. After the thorough history and an evaluation, the presence of the IOL, the position of the IOL, the presence of a posterior capsule split or a rupture, the OCT imaging techniques, UBM and photo documentation was done. And the classical feature that we found in all cases was that there was a posterior capsule rupture which presented to us in these ways with either an IOL decentration within the bag, outside the bag, or totally onto the retina, into the vitreous. And it was always a clear, relatively intact capsular bag. You can see the intact capsular excess margin, only there's a posterior capsule split with a clear posterior capsule, and the IOL decentered. 46 eyes underwent surgery for IOL exchange in all these cases. 30 eyes had in the bag IOL, and 16 eyes had a total dislocation into the vitreous cavity. What was predominant was that 91% of these were males, and this was statistically significant. 58% eyes had entire or part of the IOL inside the bag, and 30% had total dislocation. The age at presentation, 76% eyes presented between 61 to 80 years of age. The time after the cataract surgery, 75% presented between 11 to 20 years of age. 36 patients had unilateral, 7 patients had bilateral, which was shown for the first time. More than 50% eyes had axial myopia, 87% eyes had an improvement in the total visual acuity. The dead back syndrome, the axial length, more than 53% had more than 24 millimeters of axial length. That means they were myopic. The type of IOL in the primary cataract surgery, 71% eyes had the single-piece hydrophobic IOL, with the least number in the 3-piece and hydrophilic and the PMMA. And this, the test of multiple proportions showed a significantly higher number of the single-piece hydrophobic acrylic lens. This was statistically very highly significant. And the duration between comparing the IOL exchange was not statistically significant. The IOL explantation after decentered was done after a detailed preoperative examination, and we used the 3-port pars plana vitrectomy by a retinal colleague. And we used the Yamani technique of intrascleral haptic fixation of a 3-piece foldable lens. The postoperative outcomes were visually acceptable. We had certain complications like the early IOP spike, which was medically managed, cystoid macular edema, which was medically treated. Only one person needed Ozurdex because of a persistent cystoid macular edema. The epiretinal membranes were not very significant and were left alone, and we had optic capture to pupil in 2 eyes, and a retinal detachment which was detected on table and treated at the same time as the secondary IOL. So in conclusion, the risk factors were male predominance, myopia, duration of PCR from the primary cataract surgery. It's a bilateral disease, could have a genetic predisposition, which needs further research, and clinical implications are that patients must remain in lifelong follow-up. And we have an ongoing research on histopathology, which shows paucity of the lens epithelial cells to be the major contributor for the dead back syndrome. And we are doing genetic studies where we have found gene variants which have been identified which could predispose to posterior capsule fragility. Thank you.
Thank you so much, ma'am. What percentage of cases would you say was there in your series? I mean, how much was the percentage of dead back syndrome?
We could say about 0.1%.
Right.
Totally. But since we are a tertiary eye care center, we have implanted, since the early 2000s, we have been implanting the hydrophobic single-piece Acrysoft lenses.
Right.
But it's only recently now, since we are 11 to 20 years down the line, we are seeing a lot of the dead back syndromes.
Right.
It is increasing in frequency.
Sure. Thank you so much.
Thank you.